for their support throughout this series. Today's topic is how do changes to Medicaid and food stamps impact our community? We have a panel of local experts here to discuss the impact of the changes that will take effect tomorrow on March 1st and what people can do to make sure their food and healthcare needs are met. This topic is of particular interest to us here at United Way of Greater Cleveland. We are part of a national network of 211 providers that covers most of the state and country. 211 is a confidential service available 24/7 every day of the year and is provided free of charge to anyone needing help. As the operator of 211 for our community, we focus on assisting the over 1.5 million people living in Cuyahoga County, Cuyahoga, Ross, Darke, and Belmont counties by connecting them to services that address a wide variety of needs. These include helping people recertify their Medicaid and SNAP benefits, enroll in new benefits, and find food and healthcare resources. If you or someone you know needs help, we hope you will call us at 211 today. And with that, I am honored to introduce today's moderator, Taylor Wisner. Taylor is a health reporter for IdeaStream Public Media. She previously worked for Interlochen Public Radio in Northern Michigan and WDET in Detroit. Taylor, we are so grateful to have you as our moderator. I'll turn it over to you now to kick off the conversation.
Thank you, Sharon, for the introduction. And thank you, United Way of Greater Cleveland, for hosting this series of events and for inviting me to moderate this critical discussion. I'd also like to thank IdeaStream Public Media, my employer, and WOVU 95.9 FM, who will be live streaming today's conversation. And so that everyone understands how we will interact as a community today, we will begin with questions that I've prepared for today's conversation. There will be a public question and answer segment at approximately 12:40 p.m. when questions from the community will be heard and shared with our panel. You can start asking your general questions at any time during today's program, and we will make sure that we get all questions answered if possible. And you can text your questions to 216-307-5632. Or if you're listening on Zoom, you can type them into the Q&A box on the bottom there. At this time, I'd like to introduce our panel of experts. Today, we are joined by Kevin Goen, the Director of Cuyahoga County Job and Family Services. Mr. Goen began his public service career at the Cuyahoga County Child Support Enforcement Agency in 1996 as a support officer. After progressively moving through positions in Portage and Cuyahoga counties, he accepted the director position for Cuyahoga County Job and Family Services in 2018. Welcome, Kevin. And we've also got Tiffany Scruggs, the Vice President of Client Services at the Greater Cleveland Food Bank. With 20 years of nonprofit experience, Ms. Scruggs currently leads the Greater Cleveland Food Bank's client services efforts to integrate critical feedback from community members and partner organizations. Ms. Scruggs helped spearhead the Benefits Access Partnership local consortium and serves as member of the Greater Cleveland American Rescue Plan Council. And we also have Andy Traers, the Deputy Director of the May Dugan Center. Mr. Traers focuses on May Dugan Center's operations, the food and clothing distribution program, fundraising, and external relations. During his time overseeing the organization's food distribution program, it has grown from serving 53,000 meals annually to serving over 560,000 in 2022, and has added innovative programming such as year-round produce and home deliveries to older adults. Welcome, everyone, and thank you for taking the time to lend your experience and perspective for today's dialogue. We'll start with changes to the Supplemental Nutrition Assistance Program. Starting tomorrow, the extra benefits families received during the pandemic will be cut. And I'll turn to you, Kevin. Can you talk about what this will mean for folks?
Sure. Thank you. Well, to start off, for 3 years, the SNAP program has had an emergency allotment it's been referred to that brings all families up to the maximum amount. All families have been receiving at least $95 extra every month in food assistance. And across the county, that's meant $20 million every month in extra assistance. That's been going on since March of 2020, and it's now ending. The Consolidated Appropriations Act, enacted by the federal government back in December, untied this program to the pandemic health emergency and simply put an end to it as of February of 2023. So today actually is the last day that that benefit will go out there. This will affect 200,000 plus families in Cuyahoga County. That's how many, individuals in Cuyahoga County. Roughly a fifth of the population is receiving food assistance through the program, and it all ends today, as you had mentioned earlier. So there's a fairly significant countywide impact in terms of $20 million every single month. This will also impact grocers, but the biggest thing is that it has been a windfall for so many people and helped them meet their food insecurity needs during the pandemic, and now it's going away.
Yeah. We've known that this assistance will there will be a stop date to this since it was announced 3 years ago. And I'm wondering, for each of you on this panel, how have you been preparing for these changes to go back to the previous allocation for benefits for the STAT program?
For us, I'll start. For us, it's all about communications. So this is a piece of that. We want people to know the unfortunate reality is $20 million in federal benefits every month is not something the community has the resources to simply replace. And so we've been working very hard to get the word out to make people understand that this is ending, that the state, the county aren't part of the decision here. This was cut at the federal level. And we want people to be well aware prior to the actual ending. So we started communicating on January 11th out to the media. And that's been our biggest thing. And we partner with the food bank. I'm sure Tiffany has a lot to say here. Let them know that they're going to see an increase in customers. And let people know some of especially the food bank, Produce Perks is a program out there. We try to let people know some of the programs out there to help them. But this is a big gap to fill.
Tiffany, do you want to go next about what the Greater Cleveland Area Food Bank is doing to prepare?
Sure, and thank you, Kevin. You're absolutely correct. Have a lot to talk about in terms of our neighbors and what we're headed for as it relates to food access. I will share with everyone on the call today, and happy Tuesday, that for those of you who are unclear about food banks and our efforts to help connect individuals to food, in addition to the distribution of food and food access, we also help individuals and partner with our local jobs and family services team to help widen access to SNAP. And so SNAP provides 9 times the amount of food as food banks can. And so, for example, last year we distributed a little over 50 million pounds of food, and SNAP was able to provide 9 times the amount of that. And so to just hone in and emphasize what Kevin said is that the community simply cannot make up for this federal change. But what we can do is to provide awareness so that individuals know how to access feeding programs, such as the one offered by our valued partner at May Dugan and others on the call, in terms of the 1,000 partner organizations that we work with in our 6-county footprint. And so when we look at just some local data, we talked about SNAP revenue, and I'll emphasize that data point again. Here in Cuyahoga County, $23 million reduction of lost SNAP benefits. When we equate that to meals, we're looking at about a 6.3 million meal reduction per month. And this equates to 75 million meals lost. And so people are really the ones impacted by this. And so we continue to understand and be a part of the overarching communication strategies to make sure that we're helping to reduce stigma for our neighbors that might not yet have reached out to us for help. But so they understand that moving forward, that there's somewhere that they can go and access food, whether it's a food bank site, a hunger network site. We recognize there are many nonprofits and individuals committed to making sure our neighbors has access to the food that they definitely deserve and in order to thrive.
Sure. And thanks so much for having me today. So at the May Dugan Center, at the pantry level, the food program level, we're one of the 1,000+ partners that Tiffany referenced that partner with the food bank to provide food assistance each year to our community. And what we've been doing to prep for this reduction in food stamps, the additional allotments going away, has really just been trying to increase our capacity where we can, understanding that we're never going to be able to fill that full gap. But in March, there are going to be folks that either didn't know about it or haven't quite figured out how they're going to keep food on the table in the short term, and they're going to be coming to pantries like May Dugan and throughout the community. And so seeing, ordering extra food, recruiting extra volunteers, really just trying to stretch our capacity to meet this need, and then helping folks figure out, developing plans and strategies to help folks figure out longer term solutions.
Yeah, great. Well, it's nice to know there's so many community organizations out there that are focused on this issue. Something we all are probably focused on in our daily lives is inflation right now. It's up 6% compared to this time last year. How is that being felt alongside this coming reduction in benefits? Maybe I'll turn to you, Andy, if you've seen that impact.
We've definitely seen that impact. So for our food distribution program, we almost tripled in size from 2019 to 2020, and then increased another 20% in 2021. And our hope going into last year was that our numbers would start to taper off as we kind of moved beyond the pandemic. However, inflation just sent our numbers back up again. So last year was a record year for us. And it's mainly driven by inflation. And so while the emergency allotments were attached to COVID and were a COVID era benefit for people, they also had the secondary effect of helping people through the past year with increased food prices.
Yes, and many households receiving SNAP benefits may also be receiving Social Security. And we know there's been a recent change in the cost of living adjustment for that. Kevin, can you talk about whether that change will further impact seniors who may be losing some SNAP benefits?
Yes, thanks for the question. I would say a couple things about seniors receiving benefits. Seniors often are the people who are receiving the minimum benefit outside of the pandemic. And for those who aren't aware, the minimum benefit for SNAP is $23 per person for a month. And under the pandemic for the past three years, or over the past year at least, they've been receiving $281. So seniors who only qualify for the minimum because of their Social Security income or whatever income they have are going to see a $258 reduction. It's just an incredibly significant reduction for all of them. They may see some people who get a reduction because of a cost of living increase on the part of Social Security. That happens every year that the Social Security COLAs come out. When that obviously the majority of that impact is felt in the senior community. But what we've been focusing on in our messaging in particular is the fact that many seniors during the pandemic have been receiving that maximum when they only be receiving the minimum outside of these special pandemic or COVID conditions. So it's a $258 reduction. It's incredibly impactful for the senior community.
Yeah, that's a huge loss there in benefits. I mean, Andy and Tiffany, what ways can we make up for that? And can we even make up for that reduction for seniors?
Sure. I can start and then pass it off to Andy. The short answer is no, we cannot. Just to put emphasis in terms of senior households that we continue to be concerned about. And I will say the goal throughout the pandemic and even prior is to help individuals reach food security. That means that individuals simply know where their next meal is going to come from. Talking to some seniors just last week at one of our pantry locations, while we appreciate the resiliency, our senior was very honest and said, I'm prepared to no longer eat 3 meals a day, then I'm prepared to decrease and eat 2 meals a day. And so I need us to just think about that for a moment as we think about also Medicaid access and overall healthcare challenges that our community members will face due to this federal change. And so we are deeply concerned also about households with children. We understand that households with children also face a few $100 decrease as it relates to the lowered SNAP monthly allotment. And so once again, just putting emphasis on helping to encourage our neighbors to access those free local food resources first, and then go to the grocery store to really help their dollars stretch. I will say, you talked about inflation. We've seen it here. So when food banks see it, you go to your grocery store. I know we all use the egg example as one to really hit home in terms of inflation. But for example, a truckload of green beans here for our food bank that serves our feeding partner network of the 1,000 organizations I mentioned, $18,000 was the cost about a year and a half ago. And that same truckload of green beans is now $6,000 additional dollars at $24,000. So just to kind of help you understand from a food bank's perspective and how that will trickle down into the community. So Andy, I'm sure you have some examples that you want to share with the group today.
Yeah, so, particularly with our delivery program, which, we launched in March of 2020. We had never done delivery before, and now it's become an essential component of our food distribution. And every round we're providing, over 200 seniors and other folks with a disability home delivered groceries and fresh produce. And so, those folks in particular have, some of the least options because they have the highest barriers around, transportation, mobility issues, other ways that prevent them from receiving food. And, we can only deliver so much, both because of supply and capacity. But, with this reduction, it's going to be even harder for folks. I'm thinking of one of our seniors who's in her 90s, who was caring for her sister, who was also in her 90s. And, they've been receiving food from us for the past 3 years through our delivery program. And, this is going to be a huge strain on seniors like Miss Ruthie.
Yes. Kevin just spoke earlier about the number of people that are on SNAP in Cuyahoga County. I think there are misconceptions about who is eligible for these programs. Kevin, can you speak to how, who are the families, who are the people that are using SNAP, and, talk about how widespread it is?
Thank you. So the population, obviously, over 200,000 people in Cuyahoga County, so roughly 20% of the population is receiving SNAP. Of those people, the majority of them are actually working. So that's a common misconception that's out there. The individuals on SNAP, many of them are working. They're working families who simply their standard wages can't put enough food on the table. And so they take advantage of the SNAP program. We have people who are on SNAP throughout every community in Cuyahoga County. People think that it's just in Cleveland. It's not. It's in every community, every town, city in Cuyahoga County. There are people who are on SNAP. We have roughly 20% of them are seniors. The seniors came up. Roughly 37 to 40% of them are minor children. This affects everybody in the community. I can't stress that enough. We have people who are on SNAP in every city within Cuyahoga County.
Mm-hmm. And Kevin, how can people in the county figure out, what their SNAP benefits are going to be come March? Can they calculate that on their own, or is that something that you would work with them on?
The easy way to do it is the emergency allotments have been sent out as a secondary benefit. So individuals who've been receiving SNAP, they have their standard benefit they receive towards the beginning of the month. And then the end of the month is when they receive that emergency allotment. So to simply back out that second payment, realize and even simpler, that second payment isn't coming anymore. So the first payment you received of the month, that's the amount you were going to be receiving from this point forward.
I'll have another one for you, Kevin, but I think I'll open this up to Andy and Tiffany too. But as the news has come out, I think there's just been a lot out there about these changes, but do people understand really what this impact is going to be for them? Is there any confusion about changes to their SNAP benefits? Starting with you, Kevin.
So we haven't seen, so certainly people called when the news items started coming out and all to understand what's going on and all. But one of the points of confusion is this is not a change that they can appeal. We're a federal benefit program. There's always an appeal process for us for decisions the agency makes. This isn't one of them. So a lot of people are confused. They think they can say, but I need that money. Therefore, they request what we call a state hearing. They can't request a state hearing around this. This is simply going away. So there's some confusion as to sort of, is this negotiable? And unfortunately, it's not. The funding's simply going away. So that's the one point of confusion that we've seen. I think I'm going to learn a lot more in the next couple of weeks. And especially towards the end of March when that second payment does not come. And we'll see how much more confusion there be. We've been, as I said, messaging through the media for the past 2 months. We've gotten some, but the real impact will come when that second payment doesn't. And that's when we're going to see more people calling confused, concerned about how they're going to put food on the table. And I hope that we've reached the majority of the population, but I know I'm going to get calls starting at the end of March, wondering where that second payment is.
Yeah, and to Tiffany and Andy, I mean, $90 less a month. How can you prepare for that? And what do you tell people who call or who you meet with, at the food bank or at these pantries who say, what should I do to prepare?
Correct. And Andy, if you don't mind, I'll start again and kick it to you. Once again, there's been mass confusion. And for many of us, it's just natural advocates, right? It's always, what can we do to change this? And so as Kevin mentioned, there's not anything that we can do yet to change this. What we will continue to understand is just the negative impact that this will have. We've also been working very closely with the EBT retailers and local grocers and farmers associations who accept EBT as a form of payment, so that they can begin to prepare and make adjustments based on the revenue that they've had access to because of this increased benefit. And so when you think about the potential for job loss within our community, this becomes a much larger issue than I think folks really realize. Also, just looking at some hot off the press national data, and when we think about statewide, something that I think it's hard for us to conceptualize, but it's real. How many of us could really under the USDA Thrifty Food Plan, which is very complex, but how many of us could survive off $6 a day in terms of food costs? And so I just challenge all of us, stay tuned. We'll kind of coordinate a massive SNAP challenge so that for those of you who have not had lived experience of hunger, can really understand what some of our community members are faced. Unfortunately, $6 is not your baseline. There's some individuals that will be expected to survive off of much less than that, and that's once again per day. So once again, confusion is there. We continue to elevate and provide awareness. We also encourage individuals to not overwhelm your jobs and family services offices by calling. The toolkits are available. Many of our local grocers have communication that's available. For those that have access to technology, it's there. And so we really continue to push this out. But similar to Kevin, we truly won't have the impact until later on during the month of March, where we'll begin to make sure that we're equipping our partners and overall communities with additional information. So Andy, I'll pass it to you as well.
Yeah, so I mean, in terms of getting the word out, last week at our drive-through distribution, we were, talking with folks about these changes in SNAP, and a lot of folks knew that SNAP was changing, which in some respects is good news. It won't be a surprise for some people. They had found it online, they found it through community partners, through their health insurance, their Medicaid providers. But in terms of what they were going to do about it, that part was a little bit more tricky to figure out. They were obviously at May Dugan to receive food, but knowing how they're going to fill that gap. And I guess one point, going off of something Tiffany just said, as folks go from having, a full allotment, let's say, $280 a month to purchase food down to 23 or a lower amount, that often they're going to choose less healthy options. That in a lot of cases, the fresh produce is more expensive than some of the, high sugar, low nutritional value foods. And so, this will have impacts, it'll have impacts in the moment on people's ability to feed their families, but it'll also have longer term impacts on people's health.
Mm-hmm. And I'll just butt in again and say that if anyone has questions that have come up as you've listened to our panelists, you can text them to 216-307-5632. And we'll return, Kevin, as you've talked with people, have they shared how they are going to make this adjustment? I know Tiffany mentioned basically cutting some seniors talking about cutting a meal a day. And I think if we can all imagine having 3 years living under one budget and then, having just a little time to switch over to a new budget that's significantly less, have people asked questions about, other services they can get, or, questions of you on how they can figure that out.
So some of the things that we are, first of all, kind of going back to Andy's point earlier, there's a program called Produce Perks. So yes, a lot of times people resort to cheaper food that's more filling, that's not necessarily good for you. The Ohio does offer Produce Perks where you get a credit for every dollar you spend towards fresh produce. So you actually can stretch your dollar more using that Produce Perks program. You got to find out, I can't give you a list now, but which local grocers are actually taking part in that program. But that's a way to stretch your dollar and stretch your dollar by actually accessing more healthy food. So it's one thing we'll recommend people do. But also point out that some people have during the pandemic actually banked some of their benefits. Your benefits will remain on the card. They don't go away if you don't use them this month. You have to not use your card for a total of 9 months for the Fed or the state to take that money back. So some people, when they learned, started banking a little bit. So if they had $500 a month, they started only using $300 or a little more a month, so that they had a little buffer there at the end when the benefits truly went away. So it's a good strategy, but you have to have been, it's a little late to engage in that strategy now, obviously. But the benefits do stay on the card. And people should be aware of that. And then we're turning to our community partners, particularly the food bank, to let them know that there are other entities out there to help people connect with healthy food.
Yeah, Tiffany, circling back to what you mentioned with inflation really putting a stress on the food bank's ability to really buy in bulk and supply that much needed food. Supply chains were a big issue in the pandemic. Have we found ways around some of those challenges, or is that still impacting your ability to purchase food?
Oh, it absolutely has impacted our teams whose sole responsibility is to source food. And so I realized just the misunderstanding. If you don't understand food banking or not a food banking staff person, you just wouldn't understand it's very complex in terms of national, state food products and opportunities to source food. Really, the short answer for us is that we can access it. It just has been a significant higher cost to do so. And so when you think about our reach and our increased capacity, for some of you, you might be aware that we just recently moved into a larger food distribution center, which will allow us to adapt and increase our own capacity. The good news and also unfortunate news is that since October until now, our new building is serving its purpose, where we've been able to distribute an additional 1.4 million pounds of food through our feeding partner network, which is good. We understand that this will continue to increase the demand for emergency food will continue to be on the incline, unfortunately. And so it will be difficult to try to manage and understand product that is not available to us. We're unfortunately already receiving notice from our state partners that some of our truckloads that we were expected to be delivered later on this fiscal year, so in the months of July and August, we won't have access to that. And so this now forces our team to understand what other food distribution organizations are available for us to reach out to and also align with the same costs so that we continue to be good stewards of community dollars.
Right. Well, I just want to remind people in about 10 minutes, less than 10 minutes, we'll go to community questions. But Kevin, I want to turn the conversation to the changes at Medicaid that we're expecting. The Ohio Department of Medicaid resumed normal operations in February. And as a result, that means some Ohio Medicaid members will be disenrolled from the program. Can you tell me why this is changing and who is impacted?
So the why is the same reason the SNAP. It's the Federal Appropriations Act. They untied the Medicaid pandemic conditions from the public health emergency at that point as well. And what that means practically is that beginning, as you mentioned, beginning in February, the state started the work of unwinding or return to routine operations. It's gone through a few different name changes, of course, over the past couple of years. But practically speaking, in March of 2020, the federal office, the Center for Medicaid and Medicare Solutions, had created or rather pushed out a rule that said that anybody enrolled in Medicaid during the pandemic will continuously be enrolled until the end of the pandemic. And so anybody, if you had signed up in March of 20, you could not have been removed from the program by us. You could only be removed if you moved out of the state of Ohio, if you passed away, or if you asked us to remove you from the rolls. That is not a normal operating condition for us. Normally every year, every 12 months, you have to re-up. You have to recertify that you are still income eligible for Medicaid. That has not been happening at all for the past 3 years. What that has meant is back when all of this started, back in February of 20, we had about 380,000 people on Medicaid in Cuyahoga County. It is now 460,000 people on Medicaid in Cuyahoga County. So an 80,000 increase over those 3 years, almost exclusively tied to that simple rule that you can't be kicked off during the pandemic. So starting in February, they're going to start the review process. The actual impact will be felt in May. People will not start to lose their Medicaid benefits until May 1st. That'll be the first round. We're going to review everybody monthly. For people who had been on Medicaid and are due for certification in the month of in the month of April. The review process began in February. They're going to actually get their packets asking them to renew tomorrow. They're going to be mailed out, so they're going to get them probably early next week, quite frankly. And then they need to respond to us. And if they still qualify, that's great. If they don't qualify, then they'll be removed from the rolls. And that's going to be a 12-month process. Thankfully, there was some suggestion of just doing it all in a month or two. And there is at least one state who's trying to do that. But we are not. It's over a 12-month period. There are a couple of things, good things that are happening. The state office has improved what we call a passive renewal rate, where they actually, through automated systems, they do database searches, and if they can confirm the individual's income has largely remained the same and they still qualify for Medicaid, the system will just simply recertify them, and it doesn't have to be manually reviewed. They don't have to do anything. They've improved that. So we're around 50% of the population will actually see an auto, what they call a passive or ex parte renewal, and they won't have to fill out paperwork, and they won't even receive that March 1st letter. But the remaining population will get that manual letter, will need to comply, and will need to send that in. It is a significant amount of work that we haven't seen for 3 years. Our biggest concern, quite frankly, at this point, is because no one has been removed from the program for 3 years. We know we have a lot of bad addresses at this point. While we were reviewing and renewal notices were going out this entire 3-year period, no one was removed for failure to comply. And so we know that people have moved, and we know that we have a lot of bad addresses in the system right now. When we talked about the SNAP program, what can people do to help or help themselves? Make sure we have got your right address. You can log on the self-service portal at benefits.ohio.gov and update your address. There's also an 800 number. Of course, I don't have it off the top of my head. They can call and report to the Office of Medicaid address changes. We're doing a lot to try and make sure that we have correct addresses. But that's the biggest thing people can do right now. Make sure that when those notices go out, you get yours.
Yeah. And to make, another point that you shared, 460,000 people in our county, that's a third of the population. We're talking a significant number here that, things happen in 3 years that they might not have their addresses right. Other things may change, their busy time, and, this information is critical that we get out, that they need to go through this process again. Do you know how many, based on the changes happening, could lose their Medicaid coverage?
I do not, because unfortunately, Medicaid requires a thorough income review. So we won't know that until we go through the reviews. You could do the simple math of saying 80,000 people were added during this time period, and probably 80,000 would be likely removed. But that's pure speculation. We don't know at this point how many people no longer qualify. Our biggest concern is not necessarily the population that doesn't qualify. It's the people that do qualify, don't get the notice, or don't take the notice seriously, don't realize how important it is to return that in a timely manner. Those are the ones we're really worried about, that they qualify, they need those Medicaid benefits, and because we had a bad address or because they just ignored the mail, they end up losing their Medicaid. That's our biggest concern during this quite frankly, a bit of a chaotic time.
Yeah. And I'll go to you, Tiffany and Andy. What happens when people lose their Medicaid benefits? Does that have an impact on food insecurity?
I mean, absolutely. We've talked about the importance of not only access to food, but access to healthy food. And so if you couple that with the potential loss of your health care, that could be life-saving medications, for example, your routine checkups, to also align with just access to a healthy diet. And so it definitely has a correlation. And once again, I'm just very empathetic to the task that Kevin and team have in terms of that additional administrative burden that exists when you have a change like this. So Andy, I'm sure you are concerned as well.
Yeah. And, for that 80,000 people, 80,000 or so that joined the Medicaid program in Cuyahoga County since the start of the pandemic, they've never had to re-verify before. And if they signed up early days of the pandemic, they may not remember it because there was a lot going on. It was all new territory for all of us. And so, those folks, even if they haven't moved, may be unfamiliar with what to do in terms of, renewing their benefits and submitting the correct paperwork. And so really working with those folks that are still eligible, encouraging them to, reach out to the various assisters that can help them with the benefits, like the food bank, like 211, like organizations like Maydugan and other social services throughout the community, really to help them understand what they're getting in the mail. I know the county JFS office does a really good job of, making the language as clear as possible, but some folks may just not, there may be language barriers. They may just not fully be able to read or understand what they're reading.
Yeah, and if I could, I know, Taylor, we want to move to community questions to build on something Andy just reminded me. Both for Medicaid and SNAP, there are so many people, I don't know the number, unfortunately, there are so many people who know nothing else. They started receiving SNAP or Medicaid during this pandemic. They don't know about the fact that there are regular recertifications that they have to complete in order to retain their benefits. They don't know that the second payment was always a maximum because they've known no other program. It's always been like that for them. And so that's an impact we haven't talked about. That's a very real phenomenon that we expect to see a lot of community pushback on, community concern around as we go through this process of returning to routine.
Right. Yep. Okay. So we'll move to community questions now. And just a reminder, if you haven't yet, you can text your question to 216-307-5632. Or you can, if you're on the Zoom, you can put them in the chat and we'll get to it. And to start off, one question is how these changes will affect college students. A lot of college students are couch surfing and some are homeless. Is this going to have an impact for them?
Yes, I think Tiffany may have some comments, and Andy as well. But yes, it will affect college students. There's no one left untouched by by these changes. It will affect college students as well, very much so. Tiffany, if you had anything to
add. I'll just add, when we think of strategy, one thing we've talked to, for example, partners at Tri-C and other local universities, and yes, college students will be impacted by this. And so to understand strategy as it relates to putting our best foot forward to incorporate pantries and other models in terms of increased food accesses directly on the campus level and at the university, so that our students don't have that additional barrier, are just some ways that we've started to address this issue. But absolutely, once again, another population that we're concerned about. And as we think about just your traditional and unfortunate stigma around accessing SNAP, folks are pleasantly surprised to understand that individuals like myself access SNAP while in college until they're able to no longer be income eligible to receive the benefit. So we're concerned for that population as well.
Mm-hmm. One question in the chat is, asking how people can kind of lobby together to increase the monthly amount, considering the high cost of food right now. And that brings up another question I had is, are there any changes happening at the state legislatively that are working to increase that SNAP benefit, or who qualifies for Medicaid coverage? And is there anything we can, people in the community can get behind to support?
So I would say for the lobbying efforts, it's not the state at the base level. This is a federal program, and the Thrifty Food Plan that Tiffany had mentioned earlier in the program is set by the federal government. It was actually revised during the pandemic. So the actual amount of SNAP that will go out now is higher than it was prior to the pandemic. They did finally revise the Thrifty Food Plan fairly recently, and SNAP benefits at a base level did increase, but it's not enough. And that's lobbying at the federal level. The federal government sets the benefit amount across the nation, and that's where the lobbying effort should be. And for the Medicaid program, much the same. Ohio is one of the states that expanded Medicaid back in 2010, taxing my memory, to include individuals who don't have children, and include that population in the Medicaid program. So the state of Ohio did take advantage of that back in 2010. But it's always a good idea to remind your state legislators that that's a good program, because often Medicaid represents a significant impact to the state budget, and legislators are always concerned with the number of people that we're serving there. But both Medicaid and SNAP, everybody should remember they are federal programs.
Mm-hmm. And for people, go ahead, Andy.
No, I was going to mention, in the Center for Community Solutions has a lot of great resources about specifically around SNAP and Medicaid changes, and Kevin's very right that they're federal programs, and so the main legislative action happens at the federal level. But there are some state level options, particularly around support for the various county JFS offices throughout the state, and making sure that they have the resources they need to help process and answer questions and do all those applications as well.
And I'll hop in as well, Andy and Kevin, in the spirit of thinking about strategies and potential solutions in terms of, state governments really mitigating and being thoughtful about the hunger cliff, and also thinking about implementing the increased starting minimum allotment for recipients. So other states, for example, just hot off the press again, New Jersey has legislation where the minimum benefit would begin at $95 as your baseline, and also Massachusetts has done some work to be thoughtful about that baseline as well. So just as we continue to think about policy and strategy, there are tons in the anti-hunger relief space that as we learn them and understand how we can collectively rally around our network so that we can elevate and propose solutions, we'll make sure that we do just that, and we'll funnel that through United Way and our partners on the call.
Mm-hmm. There's a question in the chat for people who don't have access to technology. How do they access these resources? And I'm guessing that means, the food bank resources and pantries. Do you want to speak to that?
Sure. So, I think Sharon at the beginning reminded everyone of the value of United Way's 211 as one resource that can be offered over the phone. Another resource here at the Greater Cleveland Food Bank, we operate a call center, and that number is 216-738-2067. We're available Monday through Friday, 7 a.m. to 6 p.m. That's also an item that will be shared after the presentation today. But those are just two examples in terms of that over the phone support. We recognize the challenge as it relates to accessing the internet. And so hopefully individuals can have access to the telephone and can learn about where those available resources are located. And all of our partners will allow for a family member or someone who might have access to transportation. If they don't, once they learn of those resources, they can serve as what's called a proxy, which will allow a family member, a neighbor, to actually come and receive the food on their behalf, as long as they have their demographics. So their first and last name, the number of people in their household, and their address is helpful information to take to the feeding partner network to receive food.
And the other thing I would mention, is finding for individuals to find organizations that might be able to do free faxes or scanning for them, and a lot of the re-verification or showing documentation. As it relates to SNAP, we didn't get into deductions and ways that folks can show, their childcare costs or excess housing costs or things like that, that can help change the math. It's complicated, but it helps change the math and potentially increase their benefit if they qualify. And so, that flow of documents can be kind of a burden for people, can be a high burden for people if they don't have technology. And so, community centers, I know we do at the May Dugan Center, we are able to provide faxes and copies for folks so that to help facilitate that process as well.
Mm-hmm.
And around the original question, Taylor, we do partner with the Cleveland Public Library and the Cuyahoga County Public Library systems. There are assisters there who will help people access the technology and, as Andy mentioned, fax in information to the agency so people can tap into their local libraries for help as well.
Mm-hmm. Mm-hmm. Another question from the chat, is it possible for an agency that works with unsheltered populations to work with Jobs and Family Services to, update about these changes and benefits for their clients?
So it would depend on, we do community partner conversations every quarter. We're always trying to educate our community partners on how to best interface with us and the many ways in which people can apply for benefits, update their case. One of which is the self-service portal, which I think has been referenced a couple times today. But if you want to partner with us in other ways, it's a question, quite frankly, for us of resources and how many workers we have and what sort of resources we can devote. But I'm happy that, you guys will have my email after this. I'm happy to talk to people because normally when we start talking with individual organizations, the needs vary. So happy to talk to anyone who wants to engage on that.
And can I hop in for Kevin and as a partner perspective, engaged in serving as application assisters? Our team has been dedicated for over 10 years now to being available at our homeless shelters and other places that are deemed vulnerable, but just providing general outreach efforts. We're happy to have a team member come out to provide awareness in education and serve really as a liaison in between the community and recipients in Jobs and Family Services to help also to just continue to build relationship, but also to share that intimate information as we are trained in terms of just Jobs and Family Services guidelines as well.
Yeah. I have a couple lightning questions for Kevin for people who have questions about the specifics of, dealing with these benefits. Can families update their income information online to ensure that passive re-enrollment happens?
And so they can update their information online and they can upload documents online as well. Yes, they can provide that information online.
Okay. And will people be able to get face-to-face appointments to address their Medicaid certification?
So Medicaid, I would point out that Medicaid doesn't, the SNAP program actually requires an interview. The Medicaid program does not. So can they come into the agency? Yes. We're at Virgil Brown, which is 1641 Payne. But it doesn't require that face-to-face interaction. I understand that some people prefer that, but it doesn't require it. And we are expecting, as all these things changes, a lot of people to be calling, to be coming in, some of which, so we're encouraging people wherever possible to fill out the paperwork, to go online and all. It is, quite frankly, the administrative burden is going to be pretty big over the next year. So we're encouraging people to do that. We also want to partner with, there are many Medicaid assister programs out there, Medicaid navigators that are actually at least partially funded by the Office of Medicaid, and to avail yourselves of those community partners who are out there to help with that process.
And someone else is asking, have there been additional steps taken to communicate this information other than by mailing letters to people?
Is this Medicaid or SNAP, or do we know?
It just says this information, so I'm guessing maybe both.
So, so we have been we took it in turn because SNAP, the impact was going to happen really in March. Well, the Medicaid changes are happening now, but the impact will be felt in May. So we wanted to get out in front on SNAP first, and we've done media, we've done obviously media. The story has been covered by all the major news networks locally. It's been covered by Cleveland.com, by IdeaStream. And so we've been trying to get the word out that way. We also post on our webpage, our JFS webpage here, and we have Twitter and a Facebook social media feed that we've been putting this information out to, as well as, yes, for SNAP, they message people directly. Everybody received a direct mailing about this. So we've tried as many ways as we can to communicate this out. For Medicaid, those efforts are starting up now, essentially. We'll be doing a press release soon on the Medicaid piece. I've seen the draft. We should be ready to go very soon on the Medicaid press release. Hopefully, we'll be able to get the media coverage we did with SNAP. And then, yes, they'll receive direct mails. One big difference between Medicaid and SNAP, SNAP affected everybody all at once. So everybody is going to see that reduction. All 200,000 plus people in Cuyahoga County see that reduction in March. With Medicaid, it is a 12-month long unrolling of all of this, unwinding of all of this. So it'll only affect, the people who are due for April will be the ones who are affected initially, and then May, and then June, and also it's a slower rollout. But nonetheless, we want to get the press release out there. We want to communicate as best we can. And I should point out, we are going to there is a requirement for us to make efforts once we get bad mail back to attempt to find them and attempt to other ways to contact them.
Yeah, someone also asked, in terms of Medicaid, is this process going to apply to everyone on Medicaid, or just those who enrolled during the pandemic?
Everyone.
A question for Andy. Someone is asking, what is May Dugan service area?
So we are located in Ohio City. So half of our clients are in the city of Cleveland on the west side, but we are able to serve folks all throughout Northeast Ohio. Last year, we provided food to over 120 different zip codes throughout Cuyahoga County and the surrounding area.
We've got lots more questions, but only less than 5 minutes left. So one kind of recurring question we have is, what can people do to help, donate or deliver food? And is there potential for restaurants to be involved in a solution to the food insecurity that's very likely going to be on the rise?
Yeah, I can start with this. Yeah, so there are a variety of different ways that folks can help out, because it's going to put a strain on kind of all levels of the food insecurity system that we have here in our community. And so, be it helping at places like the May Center or the food bank or at a local pantry near you, I can guarantee that every organization that distributes food needs extra volunteers. We particularly do for our drive-through distributions as well as deliveries. But we could use help whenever. And then also, donations, as Tiffany was talking about, with, the increased cost of purchasing food, we feel that at all levels. And so, it's far more efficient to donate cash to then go purchase food. Your dollar goes farther, as opposed to, you going to the grocery store and then donating the actual food. So really, donating and volunteering are two kind of ways that anybody can really participate in helping address this need.
I agree. Just an emphasis on the ability for our food bank and our network and the buying power that we have. $1 donated allows us to access $9 worth of food, and just emphasis on volunteers. We cannot stress, we need volunteers to help us prepare food to get out to the community. You can visit either one of our organization's websites in order to get the process started. We love our first-time volunteers because that's usually a nice opportunity to connect them to other ways that they can support our feeding network.
All right. Another question, someone asked to be reminded of the exact amount of SNAP dollars that will be decreased by per family. I believe that was like $90 to $95 a month. Is that right?
So the minimum emergency allotment, the minimum extra amount has been $95.
Mm-hmm.
The average has been about 130.
Okay.
Couldn't tell you the maximum. It depends on household size, and obviously a family of 7 or 8 is going to receive a larger supplement than a family of 2. So that the wide span, I don't know, but the average has been about $130. The minimum is $95.
Mm-hmm. Okay. Well, this may be our last question in the chat. Aren't we doing everyone a disservice by not working to reduce the scope of SNAP benefits so that residents can only use them on healthy foods? Not only would that spur clients to make better food choices, but it would improve their health outcomes, lowering future costs. What can we do to push for this change?
I was going to say, I'll start. That's a loaded last question. I do agree with you that there are things that we can make in terms of the structure of SNAP. And so I just encourage you to please join our website. You can join in terms of advocacy alerts in ways that you can get involved to help make changes like that. And I'll pass it off to Kevin and Andy, who might have a short response.
Yeah, you're talking about the structure of the program at the federal level. That would again be federal policy.
Mm-hmm. Yep. So advocating your elected leaders on that would be the way to go. All right. With that, I think we're wrapping it up today. Thank you so much, Kevin, Tiffany, Andy, for being here to talk about this issue. So important. Not only that we get the word out, but that we communicate, who's impacted and who can be helped, and that we keep these people in mind going forward this year. So thank you again. And thank you for everyone who listened and asked questions.
Thank you for having us, Taylor. Appreciate it.
Mm-hmm.
Thank you, Taylor, for moderating today's discussion, and to Kevin, Tiffany, and Andy for an engaging and informative conversation. I want to also thank IdeaStream Public Media and WOVU 95.9 FM who live streamed today's conversation. And thank you to all of you for joining us today to advance understanding, engagement, and dialogue on this important topic to all of us. As we close, I just want to share a bit more about United Way 211. Last year alone, United Way 211 assisted 110,000 callers, many with multiple and intersecting needs. This is twice the number of callers compared to other 211s in major metropolitan areas in the Northeast. Not only do we connect people to needed services, but we watch the data trends to better respond to urgent needs and work to eliminate the causes. Food was one of the top 3 needs of callers to 211 last year. We responded by making connections to food pantries, soup kitchens, home delivered meals, and of course, SNAP. During the onset of the pandemic, we saw a large spike in food calls when the food pantries had to close. However, we saw a decrease in calls when SNAP benefits were increased. Unfortunately, we already have started to see an increase in the number of food requests from people calling 211, and based upon past data trends, it is likely that this increase will even further once the enhanced SNAP benefit ends tomorrow. As the 211 operator for our community, United Way of Greater Cleveland stands ready to assist people with a wide variety of needs, particularly the impacts of the changes in Medicaid and SNAP that we have been discussing today. 211 is a confidential service available 24/7 every day of the year and is provided free of charge to anyone needing help. If you or someone you know needs help, please call us at 211 today. I hope you will all join us for our next community conversation. Information will be available in April on United Way's website, unitedwaycleveland.org. All community conversations are open to all and provided free of charge. This concludes our program today. Thank you for being with us and have a great afternoon.